world of public health. In preparing for today's presentation, I was pleased to realize that this is the 5th annual Kreuter Katz Lecture. Time has gone, and this lecture series was founded by the Healthcare Georgia Foundation to honor the accomplishments in public health dedication of Marshall Kreuter and Martha Katz, and their commitment, both previous and current, to advancing health equity and public health. Gary Nelson, president and founding president of the Healthcare Georgia Foundation, which was established in 1999, has funded this lecture series, and I thought it would be useful just to reiterate the mission statement of the Healthcare Georgia Foundation to understand the importance of this lecture series. Their mission of the foundation is to advance the health of all Georgians and to expand access to affordable, quality health care for underserved individuals and communities. And in Georgia, we have a long way to go in that regard, and we're really fortunate to have the foundation with that as their mission. But even perhaps more succinctly, their vision statement is to achieve health equity among Georgians. And that is something that we all need to aspire to, work together on, and collaborate with the Healthcare Georgia Foundation in achieving that mission and vision. And this lecture series is a step in that direction. The relationship between the Healthcare Georgia Foundation and Marshall Kreuter and Martha Katz has many different facets to it. It's interesting that both have really dedicated their careers to health equity. Perhaps wasn't called that at the time, but it's all been about fairness and transparency and making a difference in the health of everyone, not just not specific groups. Marshall, for instance, had a really remarkable career as a health educator, professor, mentor, and a change agent. He was one of the first faculty of the Institute of Public Health, which is now our fully accredited School of Public Health, and has left on the school and continues to leave an indelible mark. Perhaps less well known by folks is that decades ago, Marshall Kreuter was Gary Nelson's professor at the University of Utah. So the connections are long-lasting and span decades. Martha Katz has been a public health leader in policy, legislation for decades. Worked for the Department of Health and Human Services in D.C., Deputy Director at CDC in Atlanta, leadership position in the Healthcare Georgia Foundation. Martha, I joke to people, the person I think singularly responsible for me being in Atlanta. I was at MD Anderson Cancer Center in Texas, and Martha called and said, "I have the perfect job for you." And I said, "Well, Martha, I'm not looking for a job." And she says, "Well, that's who I'm looking for, someone not looking for a job." And I was asked to come to CDC and have now spent time here at Georgia State. So the circle continues. The connections, the leadership, the personal involvement, the professional progress of these individuals is quite remarkable. And in your flyer, you can read more fully about Marshall and Martha and the Healthcare Georgia Foundation. And you can also see the individuals that we've had be speakers for this lecture series in the past. Our first speaker was Chiro Kawachi from Harvard, Jim Marks from the Robert Wood Johnson Foundation, Helene Gale from CARE, and then most interestingly and exciting, last year was Matthew Kreuter from Washington University, the son of Marshall and Martha, who are the grandparents of how many children? 4. Marshall, I had to rely on Martha for the numbers. That was never Marshall's strength with numbers. Martha would know. And so this year, we have and have had since the outset a selection committee to help find the best speaker in the nation to give Katz Lecture. And the selection committee, two of whom are in the audience, I'll ask to stand, Ginny Bales and Mary Kay McGowan, please. Just stand and thank them. Larry Green's also a member of the committee, couldn't be here, but thank the selection committee. And, you know, the committee looks around the country, or who are the leaders in doing, advancing the cause of health equity. And we brought in people from Harvard, from Robert Wood Johnson Foundation, CARE, prestigious universities. And this year we realized that the person who we are most excited about doing really cutting edge work and considered to be a leader in health equity was here at Georgia State University. So I'm pleased to announce that this year is the 5th annual Kreuter Katz Lecture. It's going to be given by Airhihenbuwa. You can read fully about Colin's career in the flyer. He joined Georgia State in August this year, a few months ago. He had a remarkable career in health education and public health at Penn State University. He was trained at the University of Tennessee. Most recently, he was dean of the School of the College of Public Health and Social Justice at St. Louis University. And when I heard that Collins was leaving St. Louis University, I called him and said, you know, Atlanta's not a bad place to live. And he said, well, I'm going to France for a while. I'll talk to you in a couple months. And he did, and we did, and here he is. So the circle continues. So without any further ado, let me invite Collins Airhihenbuwa to the podium to hear his address, We're All Others, Crossroads in the Journey for Health Equity. Collins.
Hello, everyone. Yeah, it's great to be here. And let me echo the thank you expressed to Marsha and Martha. We were reminiscing earlier today. Marsha and I were in Nigeria 92, addressing some issues of shared interest that has to do with how do you understand problems from the perspective of those who carry the burden. And Martha, the line that you use to recruit Michael, I want you to know that that is the same line he used with me when he called me. So it's good to know where the source of that encouraging strategy came. And Gary Nelson, I have to thank for your generosity of spirit in terms of the conversation and welcoming spirit you shared and showed when I first came, and the lunch we had. I'm very encouraged about your commitment and support to advancing this mission in Atlanta. What I want to, I always say in my talk that I'm not so much interested in answers. I'm interested in questions. And a part of what I've tried to do in my career is to question the question. It was really born of how I got interested in studying culture, recognizing that professors who represented the space that nurtured me, represented that space in a negative way, were not always doing it for being mean. There were a number of issues with which they were not familiar, and the way in which we frame different contexts either represented as a problem or a norm. And what I thought I should do, not having a language to engage this conversation, was to begin on a journey for change. to change the way we think about different spaces, different contexts. A journey for change is very different from change and journey. Mark Nepo said it best, that change without journey makes you a chameleon. Journey without change makes you a nomad. A journey for change makes you a pilgrim. So the crossroad that I want to really talk about is a space where pilgrims come together to really address difficult questions. Questions that we often don't want to engage in. But with the understanding that the difficulty of the question should not create a sense of devaluing in ways that we refuse to continue the conversation. And I'll talk, as I share my thought with you, you begin to understand what I mean. When we talk about spaces or intersection, crossroad, the notion always invokes some sense of confusion. Maybe road signs that gives different direction to places that we may want to visit or not visit. Or maybe some type of chaotic engagement where movement requires some type of careful navigation. But the crossroad I'm talking about really has to do with how collective identity come together to nurture a space for difficult conversation, recognizing that we always start with where the strength lies. And in relationship that we have been accustomed to in a global context, the Malian historian Amadou Hampâté-Bâ once said that the hands that give is always on top. It also occurs to me that in the spirit, in the context of engagement, the position of pontification is often at a higher platform. So the context of engagement when we are at a crossroad is how do you occupy the same space, the same platform with those with whom you want to engage in this difficult conversation. I step down with the assurance of my friends at the back that I can move around and you are still able to capture. Thank you. He's giving me a finger, but I presume it's the right finger, not the. So Bach gave us this lesson that stuck with me. The hand that gives is always on top. Whether it's a professor-student relationship, whether we are dealing with economic level, because it's very often we talk about the hand that give and the hand that receive. We think about that which other people engage in, not us. The first point of conversation at a crossroad for pilgrim is to think about what role you play when you change position. Are you the hand that, or have you ever been the hand that gives? Are there position or situation where you are the hand that gives? And are you, and what position are you when you are also the hand that receives? So what I want to do is talk about three critical areas that becomes a way of framing what a crossroads represents. I've given talk about claim your space, and I talk about the importance of understanding that you are an actor within your space and you have to learn to claim it. But claiming your space is also a way of identifying culture, and culture as not monolithic. We all tend to embrace multiple strands of culture, especially in contemporary times, and how you claim that and occupy that space. And then to own your crossroad selfhood identity again as locating you at different points within that crossroad. Keeping in mind that crossroad is now a challenging space to engage in difficult conversation, whether it's at the level of race, culture, sexual orientation, sexual identity. There are ways that we have to understand who occupy that crossroad and how do we engage in this conversation. And beyond the space that you occupy, what is going on in other spaces? And how do you learn to embrace those other spaces and understand that to address equity, it's not enough to simply look at the negative markers that we tend to define in terms of disease outcome. Is trying to understand the foundation, the structure, the way in which our nature of relationship, whether it's systemic or structural, precondition the outcome that we end up having to wrestle with. So the notion of GLOCO is a global-local connection. I've often said that when we say global, we must always remember the local is a part of the globe. And that is what the distinction is between international. International, we often think about crossing boundaries and crossing borders. To create spaces, crossroads, that allow us to tackle these difficult questions, we have to think global. So everything that happens in Atlanta offers global possibilities so that and then I'll talk about how some leaders have used that in the past, even here in Atlanta. But to get to that, we have to start to unlearn some of the assumptions we make about learning. How do you unknown that which you know? How do you unlearn the assumption that you have become so accustomed to? We theorize along disciplinary line. We identify ourselves in this vertical language that really doesn't allow us to go beyond how we are trained and how we understand. We look for evidence. We look for something that is very vertical. Structures of organizations that provide funding are such that they are aligned with those disciplinary fields that in terms of how we create institutions of higher learning. And then from there, we're trying to look at what can we do to have an impact on some of the disease outcome that has become or gaining increasing burden. Infectious diseases, non-communicable disease. You even have tropical diseases or neglected diseases. But we are trying to understand it from genome to the globe. And how does this happen at the generic level? How do gene protein expression impact on the sort of behavior to the language, where we are even changing language of exposure and looking at exposome in terms of what are the levels of vulnerability at the proteogenic level that allow us to understand what predisposes or what creates vulnerability to the conditions that we study. And in between, public health is struggling with the processes. So a lot of the things that we are doing is really trying to connect the assumptions about behavior, about learning to outcome. But the processes do not always allow us to look at the structural issues, because we are trying to study behavior, we're studying people, we're studying structure, or we should. But the language with which we define the problem is in language of disease. So the question is, if we are going to function at Crossroad, we have to learn language of interdisciplinarity. We have to understand how you address issue of identity. We have to start looking at the question of equity and how it's different from equality. And I've said in previous lecture that we cannot confuse equality with equity. I use the example of airport bathroom. If you're traveling at busy time, go to a busy corridor at any airport, there are equal bathrooms, men and women. If you were to stick with just two gender, which is problematic in itself, but if you stick with that, you say that is equal. But if you measure the time spent to use the bathroom between men and women, it's inequitable. So if you were a business owner and you're trying to quantify how much time people are spending on the bathroom and you know you are losing money, you would do something to increase the opportunity and the facility that women use to ensure that you reduce the waiting time. So equality doesn't mean equity, even though we seek both, and we have to be very clear about that. The question of social justice, which is at the core of what the dean read in terms of the mission of what this lecture is meant to address and the sponsoring organization. In all of this, we are really dealing with horizontal relationship, not vertical relationship. In that space, you are no longer a psychologist or a sociologist or a public health person. You are really somebody who is trying to erase the boundary that confine the way you look at the issues and begin to understand the humanity that people that particular space. And how do we engage a conversation that allow you to pack your discipline at the gate and begin to engage in these very challenging topics. When we study in behavior, you see me use it. We tend to focus on three areas: consumption, energy expenditure, and sleep. All right? But consumption is typically with the assumption that what we consume is supposed to be something that is good for us, and we can talk about that later. But there are also consumption that is not really good for that we are concerned with. To the extent individuals find a way to engage in the behavior while seemingly protecting themselves from other elements, as you will see in this picture. So the whole issue of cigarette and tobacco use and the new behavior that a lot are engaged in that is presenting a lot more problem because we still don't know the full extent of the damage of the new behavior that is being acquired. But that's not what I'm going to talk about in terms of consumption. It's just to show you that when we say consumption, it's not everything that we consume is good. Even when we're dealing with what we consume, it is not just within one country. Or even if we were to look at one country, we can look at a span of 20 or 30 years for the same product because the portion size has changed. And some of you heard me say that when I first came to the US in 77, the size of hamburger is no longer served because it's too small to be provided to consumer. It has to be big now, and the utensils have to be big, the plates have to be big, the cups have to be big. Everything is being supersized. But it's not only there. Even here I bring in my hybrid identity. Whether it's a meal that you consume in a West African country or in Nigeria, there are some of the same issues that we are wrestling with in terms of the quality of the material that contain in the product that is being served. Whether you are dealing with the Asian market in terms of what is represented as food here compared to if you were to actually be in the country where the product originates. And these are all issues that one has to engage in a difficult conversation as to how did we get to a point where that which you are supposed to consume to make you healthy, feel stronger, is become a problem that challenges and creates burden that we have classified as non-communicable disease, broadly speaking. But the two culprits we are really dealing with is sugar and salt. And how much of this is contained in what we eat, and how do you address what the content is, and in terms of how to not just what goes on the family table, but the structure of the industry and organization that are responsible for producing this meal. So focusing on the method of dispensing the excess salt and sugar, whether it's in Maggi or some parts bouillon that is used in many West African countries, or the role of MSG, or the common liquid that you consume. It's a sort of a heresy to be challenging Coca-Cola in Atlanta, but here we are. It's something that we do have to talk about. When I was at Penn State, it was a case that when we talk about Pepsi, because it was a Pepsi campus, that's a different lecture where campuses have become identified with one sort of soda product or another in terms of what is consumed. But the issue is that it is whether we are looking at hamburger in one country, rice, fried plantain, and vegetable in one country, or just what people collectively refer to as Chinese food, which actually is always shocking when I'm in China. What I eat is totally different from what is served here. The question is, what is the salt and sugar level, and how did we come to this point? That is on the behavior side. Then the question is, how do you claim your crossroad space? The cultural element, because we are all cultural beings. And Shoyinka said it best that man is first a cultural being, which is why the result of his cultural affiliation when politics appear to have failed him. Anytime individuals that they consider them a cultural, some problem happens, then that is when they remember what culture they belong to or what group they belong to. And the question is, or the reality is that we are all cultural beings. Then in many instances, we do belong to multiple spaces, and we can claim multiple culture. And so when it comes to movement, it's culturally framed in terms of whether or not it's going to be individual or group and activity that will result in increased energy expenditure, or whether it's tied to a different way of teaching about mindfulness, or whether it's just remembering that which you are engaging or that which was important as you grew up as a child. This last slide was taken at a trip to Shanghai, China, 3 years ago at a WHO meeting, where in the school system, as they were showing us about how the government is promoting health within the schools, they showed us this exercise, which a grandfather insisted that the school bring back because that was how he grew up, where you have a rim, it could be a tire, it could be any sort of thing that you run after as a way of getting the children to move. So school systems started to bring back some of the traditional way of engaging children in energy expenditure. And I looked at it and I laughed. I said, well, actually, when I was growing up in Nigeria, we did that. Excepting that you can see my fumbling with it, I wasn't able to do it as well as some of the children were able to. But the point about it is that even energy expenditure exercise is culturally framed. It's how you engage children from very early age to begin to appreciate that which is very customary and traditional to their own space. And then sleep is a different area. I did a paper 2 years ago where we're trying to understand what sleep means. Because a number of studies about sleep now is trying to understand the negative aspect of not sleeping, whether it's exposure to blue rays light before you sleep and how that affects your circadian rhythm, and what happened to you in the morning that you tend to douse it down with coffee, and the fact that the drowsiness may be something that can be eliminated if you were to cut down the amount of exposure in the evening. That was done by a faculty member that I had at Penn State to look at the impact of blue rays light. But what I was interested in was my first trip to Spain. A friend of my wife's came to me to take me out, to just take me out to go out. And this was around 5 o'clock when she showed up and said, what do you want to do? I said, well, I'm ready for dinner. She laughed and said, dinner? We just finished lunch. So the question of what does sleep mean in different contexts, because consumption, energy expenditure, they all relate to each other. And now sleep researcher will say that sleep is above everything else. A consumption researcher will say that is above everything else. Someone who's really doing it say above everything else. But a part of the conversation is that they are all very important. There are cultures where you can sleep. The recommendation is 7-8 hours of sleep. The question is it at a stretch? Is it at a particular time of the night? Or does it count when cultures count 2 hours of nap during the afternoon? And those are the things that I question, that I'm interested in. We know that corporate leaders are now supporting power nap and creating rooms in which people are to engage in a bit, some sleep before they go back to work. So the issue or the exercise of sleep is to understand that why we say it's important, how it's framed and interpreted is culturally determined, and it all comes down to, for consumption that is good for you, exercise that is good for you, and sleep that is good for you, we are really dealing with quantity and quality. How you balance quantity and quality. What is appropriate to the type of activity you are engaging. And so in terms of dealing with NCDs and infectious disease genome to globe, we can look at what WHO or UN has recommended. A number of you would have seen this 17 recommendation that it follows the old generation of this is Sustainable Development Goal. Sorry. The Millennium Development Goal was the precursor to this. And this was designed to really expand that and say there is a lot more than focusing on the disease itself. We really needed to focus on a number of issues from hunger to gender equality, to protect the planet, to peace and justice in terms of trying to understand what is going to take to bring about equity. Now, it's a sort of daunting task to look at this because a number of colleagues that I've talked to will look at this and say, where do we enter in this? Because we are trying to look at issues at the very narrow level, and here is UN presenting us with all of this. But it's not to discount the importance of addressing issue at the best, at the level of bench or bedside, but it's to say that to have an impact, we have to focus on much more than what we've done before, which means we have to begin to question the question. And a part of that is leadership. So life is like a dog sled team. If you're in the lead dog, the scenery never changes. Because it does tend to be how we follow in terms of the assumption that inform what is this we are studying. Is following the leader without ever questioning whether or not we are moving the direction that we should be moving. And so that has led to looking at a different way of quantifying vulnerability and risk. This actually goes back to the 2008 report that WHO put out in terms of looking at social determinants of health. And that we started to look at the intra-regional differences in vulnerability and risk. And so in here, using the Robert Johnson Foundation supported map in looking at where risks lie in life expectancy at birth between Bucket and to the northwest, 12 years. So where you live, that place matter. And I was suggesting to, I think I have one for St. Louis here. It's about 12 years too, because that's where I was before coming here. I think I was suggesting to somebody earlier that I've been looking closely at the RWJ county ranking, and because I want to understand it better beyond the risk profile that it presents. The healthier, relatively speaking, county tend to cluster towards the northern part, and the not so healthy county tend to cluster towards the southern part. So Forsyth County is ranked #1. And I think Cherokee County, and there are some counties that rank very well, whereas Warren County, Crisp County, and some of the others rank very poorly. Fulton County, where we are, ranks about 14, and that is out of the 159 counties in the state. So I'm not showing that here because I want to understand it better in terms of how does identity, race, class tell us or map onto what is shown in that map. I'm more interested in that. And what about voting pattern? You know what would map onto that. I'm more interested in that. So the information is very important. I would strongly recommend you looking at county ranking if you are interested in that, because it gives you a place to begin to drill down deeper into why places matter and why identity matter. So to own your crossroad of selfhood, I want to talk about what it means to claim your space. And here I'm going to talk about one of those conversations that I believe is so difficult that we tend not to want to engage in. And it's question of race and racism. So Ta-Nehisi Coates argued that it is racism first before race, not the other way around. In fact, there's a paper that Robert Hearn and David Williams published recently that talks about this same issue, that racism is the father, race is the son. So my point was that if that is the case, who is the mother? It's culture, the nurturing space. That we're going to expand and really talk about. Why is racism the father? Is the question of the foundation. I can go through some philosophical conversation with you, whether it's the work of Immanuel Kant in Germany that started studying race and the issue of what they were really studying is racism, but it was framed within the context of race. And this whole issue has really been at the core of inequity and disparity, not talking about it. And the fear of not having that discussion, or the fear of what we think it means when you can keep it quiet or be silent about it. It was Michael Eric Dyson that said that racism is like a poisonous mushroom. It gains secrecy in darkness. We have to be able to tackle and challenge the issue of racism and why it begins to affect everyone. So that it's not a question of intentionality, it's a question of that determination to say it has to be addressed. And to begin with, it's a question that I often ask, do you know who you are without what you do? Do you know who you are without what you do? If you go into a crossroad and you are presenting yourself as a professor, as a director of something, as a head of something, you've compromised the ability to actually have that rich conversation. If we were to be at a crossroad, I would talk about myself as a son, as a father, as a husband, as a friend, as an uncle, as a nephew to some. There are different spaces of identity that I occupy in that space. I'm trying to understand how do we collectively work towards a transformation that is going to move us around, because we all agree that we are all pilgrims in this space. And there are issues that we need to tackle. We spend billions of dollars trying to address it. The problem seems to be widening. And we are all getting promoted and getting advanced. We're advancing our career. But why are we not able to achieve what it is we are able to achieve? Does it mean we haven't achieved something? No. There are a number of places where we can identify a number of positive outcomes that is come out of the investment that is being made. But it remains the question is, why do we continue to have this inequity gap? And it's easier to build strong children than to repair broken men. But what is quite interesting, I've used that before, then I couldn't help thinking about Brian Stevenson in Just Mercy that says and concluded that it requires proximity in terms of solution. If you have not read Just Mercy, it should be a required reading for everyone. That it requires proximity, you have to be there, and that we are all broken. That's just a powerful statement to say that we are all broken. So to enter a crossroad as a pilgrim, to engage in a conversation with the belief and acceptance that we are broken, we are a part of the healing, is going to take that collective effort. That to me is not an easy feat, and one that we need to really take very seriously. That we are all broken, and that we need to accept that a part of the conversation is going to lead to growth. Part of the conversation will be very painful because we are trying to collectively look at how we bridge the inequity gap. But for Toni Morrison, that otherness will continue in the origin of others. And she's argued that, unfortunately, otherness is going to continue to matter because of the structure of a system, because we are not having this conversation, because we are not looking at the structural determinant and the systemic determinant. And then, of course, as I've said, because racism is what created race, not the other way around. It's very interesting, very a challenging way of thinking about what you think you know. How do you unlearn that which you thought you knew in order to have a conversation for a new way of thinking? So just mercy, the origin of others, and between the world and me, I would say is something that is a book. These are books that I strongly recommend that you look at, because in the work that we do, I can recommend tests and recommend referee journal article. But to be in a crossroad is to begin to understand how do we engage one another. And the freshman reading for Georgia State is evicted. What is being demonstrated in the work by Matthew Desmond is the issue of how class and power and dictate and frame the question of ownership in terms of housing. And a number of the cases were based in Milwaukee, but it's very applicable to here in Atlanta. And of course, the issue of how do we engage a conversation of the persistent gender gap. Chimamanda Ngozi Adichie is saying that we should all be feminists, giving very clear stories and analogy of how we normalize a masculinized gaze of how we address some of the issues. And of course, if you want to go global, you want to look at Sapiens. Harare's work is really quite powerful and interesting in looking at the notion of that we are living in a constructed reality. And in terms of the reality, and it talks about the three revolutions that is taking place, what we call the cognitive revolution, the agricultural revolution, and the intellectual and the technological revolution that he argues started 500 years ago. But the point about this is that what Harari is arguing that as scholars, we are so accustomed to asking questions for which we already know the answer or for which we think we can find the answer. A crossroad is a place where you ask questions that you have no answer to. You are proposing it because you know it's going to take a collective effort to bring about the type of, emerging reality is what it talks about, to bring about some sort of understanding of what that means. But bring it here at home. A faculty member here at Georgia State is looking at what creates this notion of a black maker in Atlanta. He framed it as a politics and class in America, but in reading through it, I'm not done reading it, but reading everything, but I'm about to third the way through. I will frame it as the challenge of black in leadership, understanding what Derek Bell means by serving two masters. Because it was quite poignant to me, the case illustration of Maynard Jackson and Andrew Young. Among other things that is being covered. When you have to represent and serve certain institutions where governance require that you look at the entire city or state, but at the same time, as a black person, you have a different constituency that are the lower economic class. How do you wrestle with serving two masters? In fact, Derek Bell dealt with this. That's what led to the creation of critical race theory in a different context. So these are ways that you have these difficult and challenging questions that we all must tackle with. It's a question that Du Bois had wrestled with and taught us on. Frantz Fanon has done the same. Mary McLeod Bethune that said the true worth of a race must be measured by the character of its womanhood. The whole issue of race and identity, Audre Lorde that said you can't destroy the master's house with the master's tool. The tool is designed for one thing. You have to create a new set of assumptions if you want to engage a conversation that is different. Paulo Freire that asks us to look beyond the focalized view, but the totality of the experience and humanity. Is to say that these are thinkers who've been wrestling with this issue for many years. And of course, my own, one of my favorite all-time writers, Chinua Achebe, that said, no one should enter their home through somebody else's gate. No one should enter their home through somebody else's gate. But the question, of course, is if you see your gate, will you recognize it? Because if you're so accustomed of using somebody else's gate to enter yours, whether it's in terms of theory or framework, part of what public health has been saying is that our gate is not a medical gate. It's a different gate. But you may give us money to do something in the community because you understand the medical or clinical gate. But for us to understand the totality of experience and deal with disparity and inequity, we have to enter through a different public health gate that brings in the social and structural system in the analysis that we are going to offer to understand why we continue to have inequity. So you basically have to turn the world upside down to really understand how to have a crossroad conversation. I see a map in my office. What if it were upside down? Who actually said the north is the north and the south is the south? But these are all real effort by scholars to get us to rethink the way we think, to unlearn certain assumptions we become accustomed to, so we might begin to have some serious conversation. I tried this in some blogs I wrote last year when I was traveling between Paris, as the dean said, and here, and having time to reflect. The question of how can you be at home with your spirit, and how do you not become a tenant in your own soul? And this was born of experience that I've had in giving lecture in different places where aesthetically everything is there, but when I'm trying to look at some value that suggests where that location is missing. It was a case of a lecture I gave at University of Ibadan where everything was perfect as far as I was concerned, but as far as I was concerned, the soul was missing. And I had to talk to them about that. How do you ensure that you are at home in your own soul? And what does ownership mean? The French coffee. The French has no coffee farm. There are no farms that grow coffee in France. It's an appropriation, but that is so doesn't invalidate it. It simply means that to claim and to own does not mean to originate. It's something that you are prepared to accept and embrace. And because it's become a part of the culture, I can talk about French fry that somebody at the heart of political discourse with France wanted to remove and didn't really know that. Person didn't really realize that French fry is actually Belgian fry because it didn't start in France. It was actually Belgian. But anyway, that's a different conversation. The whole issue around Tuskegee, that when you ask people, particularly in public health, if they know about Tuskegee, it's always about the negative aspect of Tuskegee. Never discussed George Washington Carver, never talked about Tuskegee Airmen, never talked about all the different ways that Tuskegee's experience has actually enriched this country, become a focalized view of a particular space without understanding the totality of the contribution that space has made. So a part of owning your spirit and soul is having that conversation that we are all broken in the way we understand these spaces, but we are all broken in the perspective that we brought to bear in how we view these spaces. So it's about respect, respecting the souls that occupy a space. I never care much about acceptance as much as I care about respect, said Jackie Robinson, but it's about balancing the head and the heart. And I've said before in a different forum that Pablo Lopez, my Native American friend in Albuquerque, New Mexico, once shared with me that the longest journey you ever take is the journey between your head and your heart. And that is why your heart is in one space in terms of what needs to be done. Your head may be in where the funding lies. The funding might say, we are going to give you money to do X, Y, Z. And I used to joke that at the very early stage of bioterrorism, all of a sudden, within a year, we have all these experts in bioterrorism. Where did they come from? They are able to adapt. See, academic, we are very good at adapting. We will adjust very quickly to fit a particular profile. the heart is in one place, the head goes where the money is. How do you align it? And how do you engage a process where it's not a unidirectional journey, it's going to go back and forth? And that if you talk to someone in the language they understand, it goes to their head. If you speak in their own language, it goes to their heart. And the question of how you embrace space beyond, mindful of the time here, embrace space beyond your space, it is very challenging to have new ideas and innovative ideas when you have not moved from the space of the familiar. And one of the lessons that I learned from Legend of the Black Mecca is how the then Mayor Young was heavily criticized for doing a lot of traveling. People often say, we have problem here too. Why are you traveling all over the place? But one of the trips was really to try and learn from London Gatwick and London Heathrow, how they manage their airport and the privatization process, the revenue generated, mapped out a strategy that was going to infuse resources to actually uplift the poor, the lower class that we were all concerned about, and came up with a plan. But that plan was a result of traveling and going to different places. The plan was not approved. One of the masters were very upset with him. The other masters liked what he was doing, serving two masters in that particular position. So traveling and going into different spaces allow you to understand how you have to renew your own space. So the self and the collective, and Yogi Berra is always reputed for making goofy comments. But this one I thought was appropriate. When you get to a fork in the road, take it. Well, I used to say to when I was head of behavioral health at Penn State, I said, yeah, take it. In interdisciplinary work, it's so funny, it sounds illogical, but that is really what we're asking everyone to do at the crossroad. That is going to be more than a fork in the road, because that intersection require understanding what different lanes intersect in that particular space. So I guess the joke is on us in it, with Yogi Berra. But a part of it is how you negotiate power. Power consists nothing without a demand. It never did, it never will. And it's so true. Those who already have the resources are not prepared to give it up. How do you have a conversation that allow you to understand that the hand that gives has to come to the same platform as the hand that is receiving to have the conversation that needs to be had? To rethink the boundaries of illness and infections, in part because some of the conditions we consider infectious or chronic coexist. HIV is TB, some form of cancer is both infectious and chronic. So the dichotomy we've always created between one and the other, we have to learn to erase. To move beyond social to structural determinants. It's not enough to simply focus on the social. We have to start understanding system and structure. The question of social justice, the importance of leadership. And leadership is not about being in administration. It's not really about who is an administrator. It's about each and every one of you thinking of yourself as a leader and asking yourself questions as to what changes and transformation are you going to bring to the crossroad? And what is your role as a pilgrim in that crossroad? And what are you prepared to give up? Let me say again, what are you prepared to give up? Because a part of the difficult conversation is somebody has to be prepared to give up something, or there will be no conversation. And that is, so the mountains ahead, that is not really the issue, is the pebble in your shoes that you have to worry about in terms of the question of leadership. So we did this paper some years ago that claim your leadership development, but I'm not going to get into it, but some of the things that I'm talking about, I try to lay out we try to lay out in this paper on leadership. But the issue of leadership, I always interject with African proverb, You have to have followers. He who is leading and has no one following, is only taking a walk. You can't say you are leading and nobody is behind you. But as a good leader, you also have to be a good follower. And also that a large chair does not make a king. It's not really the size of your office. It's not the size of your backpack. It's not the price of your shoes. It's not some of the things you place value on. Is what are you prepared to contribute and give up as a pilgrim at the crossroad? Everyone has a mandate when you are within the crossroad. People have come to me and say, the head of department doesn't do this, not here. The dean doesn't do this. The provost doesn't do this. The president doesn't do this. I say, what are their mandates? What is because everyone in leadership has something they have to respond to. Everyone has a mandate. It doesn't mean you need to agree with it, but you can't put all your issues on the table. Nobody is doing this, or without really understanding what are really some priorities that they've set. How do you align with that? The question of the criteria is very different. I already gave you the distinction between equality and equity. So we may be using the same term and meaning something totally different. So we need to be able to clarify what this all means. Then diversity of generation. Sometimes it may not even be the differences along the markers you may think about. It may be a generation differences, such as the one you have in your own family at Thanksgiving, where your children are saying some things and you think they are from a different space. So we have 5 generations to talk to traditionalists and baby boomer. They are loyal and the optimist. And you have the generation S, that is the questioning generation. And then you have the Gen Y, the millennial, and the Gen Z, the balanced generation. The impulse is very different. I can't tell you how many friends and colleagues will say, well, I have this child, he just got a job, and 2 months later he's thinking about quitting. That is the language we use. We say, thinking about quitting, and say, well, maybe the child wasn't thinking in terms of quitting the way we think quitting. Because moving from one position to another for that child is not necessarily quitting, it's transitioning to something else. So, but if you are a leader in an institution of higher learning like this, you may actually have all the generation coexist in one space. How do you ensure that the priority you set is actually responding to everyone? What if you were the student in any of the level of generation, and you are engaging students, you are sandwiched between the boomers, traditionalists, and the Gen Y, Gen Z? Do you understand why there might be a discord in the types of the conversation you're trying to have? But if you approach it from the standpoint of a pilgrim and a cross space, it may allow you to understand that we are all broken. We are trying to understand how to move this issue forward. So I need to pay attention to why a particular group of people may be thinking, suck it up, get over yourself, get over it. While the other group is saying, I just want to work for 3 months and take a vacation for 6 months. And that is okay. So these are all reality within the context that we find ourselves in. And so the notion of what really even matters is different. It's not about what matters, it's what matters to you. So the intelligent quotient, it was how we started. If I go back to Harari's classification of the revolution, I can place the first one, intelligent quotient. Then we went into emotional quotient, where we are dealing a lot about the advent of even yoga and introspection as an important part of growth and development. It's actually quite fascinating to me. To the point where when emotional intelligence started creeping into our own lexicon, there are still people who were resisting. What does that mean? It's intelligent quotient. We still have reference to IQ. But we're saying if you really want to work with that middle ground of people, structure, and system, you have to understand how people emote, how they connect, how they are able to engage and accept the type of exchanges that take place within that particular context. Well, in a new generation, there is a curiosity quotient that is probably prized more than the other. There has to be a level of curiosity when we talk about entrepreneurship, when we talk about innovation. When you have the largest fleet of taxi in the world, the largest taxi company in the world has no fleet of cars, Uber. When the largest market merchandise in the world has no inventory, Alibaba. When you have the largest hospitality industry in the world, has no brick and mortar, Airbnb. So the question that you have to start asking, what really matters in the world that we have to, in the space that we call Crossroad? Because discovery electricity was not based on continuous improvement of candles. So you can't expect to keep improving on bad idea or idea that had limited utility and expect to frog leap to something that is going to be transformative. It is not going to happen. And the time to make this transition is now. The time to repair the roof is when the sun is shining. How many times you have people constructing road when it's raining or it's snowing? So the time to repair the roof is now. The sun is shining. So embrace your fear. You must do the thing you think you cannot do, Eleanor Roosevelt said. Smooth seas do not make skillful sailors. You have to pray that you face challenges, the kind of challenge from which you are going to learn and actually help you define who you are. Prepare for defeat. You may encounter many defeats, but you must not be defeated, Maya Angelou. Dare to dream. It's a calamity to die with dreams. It isn't a calamity to die with dreams unfulfilled, but it's a calamity not to dream. It's not a disgrace not to reach the star, but it's a disgrace to have no stars to reach. And this is Benjamin Mays, president of Morehouse, mentor of Martin Luther King. Travel to other places and spaces if you are going to dare to dream. Imagine your own space anew. Read, 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 read beyond what your professor assigned to you. Read beyond your discipline. The square, the crossroad had people from different identity, different impulses, different reflection. It's not going to be about, we're talking about only that which matters to us. Listen, listen, listen. It's probably one of the most important skills you ever acquire. How to actually listen and accept. You don't have to agree. Understand what the person is saying. And then you have to act. Difficult conversation, challenging introspection about who you are, always rechecking and reevaluating that which you assume to be the case. And of course, learning to be comfortable with being uncomfortable. For the past 25 years or 30 years, when I send an email, that is a byline you will see. Well, about 2 months ago, a former student of mine called me up, was very upset, and said, somebody stole your line. I said, what do you mean? There's somebody that did a TED talk, they're using comfortable with being uncomfortable. I said, let me see. It's true, somebody used, they just changed the word be to get. And it became, that's what you will see. If you were to feel comfortable with being uncomfortable, you will see get before you say be. And this is important because you have to change often. Because what Wiraja said is if you think you are on the right track, you get run over if you just sit there. So have the idea. So that's what I said to my students. I said, yeah, I can't fault them because I'll be using that byline. I've never changed it. It doesn't mean I have to change it. Somebody transform it. It became a different thing. It's not something to get upset about. It's something to remind you that if you sit there, you will get run over. It's not a question of having a good idea or have a good thought 2 weeks ago. What are you thinking today? Where are we on that same conversation? So this trick came from a display on health and human rights that the school put up in law school building. I don't know if Kim is here, if that display is still here. It's a question of trying to understand the different components of determinants of health that we really have to wrestle with. But in the final analysis, we are the one we've been waiting for. We are the change that we seek. And language and communication is really designed to condition an imagination. So I have framed this in the URISE website as a polylogue to really alter the notion of dialogue to one of multiple conversation taking place in a particular given space. That we have to be able to address a number of isms within this space with the understanding that when we disagree, we will not blame it on anybody's heart. We can blame it on their head because we know the heart is always in the right place. That's what brought the pilgrim to that space in the first place. So we'll start by flipping things upside down, and then we'll have a conversation around the table, and then we'll know that we're dealing with multiple generation, multiple identity, and of course, we remember that we are there to protect that space. That, to me, is what the ultimate goal is for health equity.
We'll take some questions.
Yeah.
Thank you, Collins. There was a lot to digest and unpack, and I hope that we have a few minutes for questions. So if anyone would like to ask a question, there are mics along the sides, so queue up. But that I think we'd like to have further discussion about beginning a discussion of Crossroads and the implications of that for a place like Georgia State, a very special place like Georgia State that has been successful in many dimensions around race and success, but there's much more that we can do. And I think it'd be useful to have a process for thinking about Crossroads and the implications for that. So please, questions? There's a mic on the side here. Don't make me ask a question. There we go. Is that Harry? There you go, Harry. We can count on you, Harry, for a question.
Thank you, Collins. That was wonderful. So something I've been struggling with lately that I hope you can help me with. And it has to do with creating a safe space for dialogue in the classroom, particularly around issues that are not only challenging to talk about, but issues that are very personal to most, if not all of us, but in very different ways. And I guess the corollary to the question is, how do I, as a faculty member, create that safe space when I may be framing the conversation, but also aware of the inherent power differential that I bring to that framing in the conversation? And if you can, maybe in 2 minutes.
Thank you, Harry. This is a very important question, and one that is around some issue that I have tried to address. First of all, students are not blanket slates when they come into the classroom. We know that you come with different sets of assumption and expectation. Whatever we can do to address issue of acceptance and belonging in one area can open up the opportunity for a student to come to you even when it's in a different area. Let me, to answer your question directly, I've talked to a number of faculty, that is small group or one-on-one, how I felt as a student when the space that nurtured me in Nigeria was always referred to as wanting, only defined in the language of poverty, only defined in terms of what is missing, which is how I got involved. This what really motivated me to want to come up with a different language of culture, always starting from the positive, because what I knew was very different from what I was being taught. And a part of the challenge was that those who were teaching me were actually well-intentioned, very progressive in their thinking. So my question was, if this is all they know, then we have to do more. I had to do more. So, and I use this to say that if you are in a classroom, because the way our profession is structured, we look at disease outcome, and we look at inequity, disparity. We look at a number of ways to try to showcase the challenges we face in certain community and in certain places. I've been in an audience where when the Black experience is talked about or identity, sometimes I want to hide under my chair or table. Because if I'm 1 or 2 or 3 students in a classroom and you're showing all this data that is showing everything negative, so the question is, are there something positive there that we can talk about? So I don't know the answer in every instance, but what I knew was that there is something positive in every contest, in every individual, in every space. And we have to do everything we can to identify those first so that we put all the negative representation in context. And the reason I started talking more about structural and systemic determinants is that we can chastise, and that's a different, I can talk about leadership, Maynard Jackson, Andrew Young, and some of the criticism they receive, but not really understanding some of the challenges in facing in terms of when I talk about serving 2 masters. But in the classroom, our data really, if our data is coming from our head, it often betrays our heart, because the data we're using is really talking about all the problems. But we have not come up with a way to also talk about some of the positive things within this community. I'll use the example of smoking. I said, African-American women, and I don't know if the data has changed, it was always the case that African-American women were, in terms of smoking, were smoke less than the other population. But I have not been in lecture where that is placed against other positive things in terms of what can we learn about this population, that they are doing something right. But we talk about all the vulnerability, whether it's HIV or so that is where's Harry? Okay, yeah. So it's a way of really trying to, for me, begin to drill down in for all the negative, the problem that we identify. Are there a way to talk about this problem before we get to this problem, to talk about certain positive, structural, systemic thing, so that it puts it in context in a way that the student sitting in class is not feeling that, oh, every time we talk about me and the space I occupy is always negative. When in fact, that is not, at least for the folks that I work with, and I would say in your case, that is not the intent. But the way it comes out is that it forecloses on conversation that should be taking place at the crossroad, because individuals start to feel they have very little contribution to offer. It's how to get there that I would want us to talk more about and work on.
Collins.
Yes.
Thank you. Collins will be available next door. We have a reception next door. Everyone's invited. There'll be an opportunity to ask Collins more questions. I think Harry's question was a very important one, and one that I'm personally committed to exploring more. And I think it starts partly with listening, creating space for that to happen. And today was a great start. So on behalf of the Healthcare Georgia Foundation, on behalf of Marshall and Martha, on behalf of the School of Public Health, we have a little gift for you.
Thank you.
And thank you for your presentation.
Thanks.
Congratulations.
Thank you.
Please join us next door and enjoy.